Houston, the Health Ministry has released a statement in response to the story we carried earlier about IGL. The Minister of Health and Wellness says it takes note of the recent publications made by the sole supplier of medical oxygen to the country, IGL Limited, and wishes to provide some context and clarity as they seek to navigate these very challenging times for the health system and the country. Now, the Health Ministry says on May 30, 2021, the Ministry of Health and Wellness, on reviewing the situation at the time, including the reproductive number, projected that a third wave could result in over 10,000 cases confirmed in the peak week, over 180 deaths in the week following the peak, and that over 1,000 beds would be required in hospitals for COVID-19 management. The ministry says at the time of these estimations, they consulted with sole supplier of oxygen to the health facilities, IGL, and it was discussed that at the last peak in March, just over 300,000 cubic meters of oxygen was utilized in the public health system for the 1 month period. In that conversation, the company indicated that based on its contingency plans that had now put in place the ability to supply over 400,000 cubic meters for a similar period if the country went into a third surge. The Ministry of Health says the estimation based on IGL supply was that the country would be able to provide oxygen up to a possible 30% more than last peak. 30% above peak demand, with approximately 1,000 beds occupied for COVID-19. This level was also consistent with the ministry's internal capacity for staffing to support beds assigned to the clinical management of persons affected by COVID-19. At and above the 1,000 beds occupied level, the ministry's contingency plan required that hospitals be placed in emergency mode, which included the reduction in use of public hospitals island-wide through the restriction in conducting emergency care services and the suspension of elective surgeries. The plan also required that health facilities would begin discharging patients who can receive home care. The ministry says at this level as well, more wards would be converted to care for COVID-19 patients. These actions are to mitigate the overwhelming of the health system as well as to manage the use of oxygen to below the capacity levels indicated by IGL. Now, the ministry further noted that on Wednesday, August 25, 2021, IGL informed the government that based on its plans and due to the increased demand, IGL has been importing liquid oxygen to supplement its capacity in country. The company also advised that one of its major suppliers of oxygen out of the United States had declared force majeure at short notice and would not be able to provide its projected shipment of oxygen. This was due in the main to the increased demand in its source market, and this reduced IGL's capacity to supply the agreed volume of oxygen. IGL therefore informed the ministry that over the next 3 to 4 days, they will especially be challenged. They have several tanks expected to arrive on the island Sunday, August 29, 2021. And that it's making arrangements with the authorities to clear them immediately as the ship docks. The company further informed the ministry that they would commence distribution early Monday morning and would normalize supplies by the night of Monday, August 30, 2021. Now, finally, it is to be noted that the ministry's estimation of use has not presently surpassed the capacity of oxygen as projected, and based on the company's own assessment of its capacity to meet the demands of a third wave. The issue that affected supply, therefore, was based on the break in the supply chain due to the declaration of force majeure and the need for IGL to find in relative short period of time a secondary supplier. At the time of this advice, the government made several outreach through diplomatic, military, and other channels to mitigate the risks that would arise. However, due to the technical nature of the transportation of oxygen, none of these mechanisms would improve the timeline for the arrival of oxygen in the healthcare facilities.